Did you lose your health insurance because of the pandemic? Well, there is time to enroll through government health insurance markets after President Joe Biden announced the reopening of enrollment periods. Everyone needing insurance has until, well, it was May 15th to enroll in a health care plan, but that just changed. We're going to talk about it right now. We have three experts to help you navigate all of the new information that is coming out. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. Now, again, they are all here to answer your questions. If you have a question, what we want you to do is text that question in. The number is 336-379-5775. Remember, this is text only, so don't call this number, but text your question in. All right, Laura, let's start with the big news. The enrollment period just changed.
Yes, I just heard about this, that we have a brand new Secretary of Health and Human Services, Sevier, and he gave a speech announcing that the new end date of the special enrollment period is August 15th. So that's several extra months to get your health insurance.
Okay, and with that said, there's a key thing about how maybe premiums or pricing on plans may change. And so what's the release date for those new plan pricing?
Well, right now, if you go to healthcare.gov, the numbers have not been updated yet. So you may want to wait until April 1st to take a look, because the numbers you get today may not be quite right, and you might be pleasantly surprised in just a week.
Okay, so again, the enrollment period now is extended until August the 15th. That is the new deadline to apply. It is August the 15th. This just happened, and then they will be releasing new pricing for those premiums and plans on April the 1st. So those are two key dates. Okay, Catherine, let's now go to North Carolina and Medicare, because there is a new kind of open enrollment that is happening statewide.
Right. So Medicaid, which is our plan in North Carolina that helps to support our a number of our disabled, a number of our lower income folks, has open enrollment to move to managed care. And so people are asked to go and pick their new plan. The North Carolina Department of Health and Human Services website, dhhs.nc.gov, is the place to go, and they can show you what your choices are.
Okay, and we do want to clarify, thank you for saying that it's Medicaid, not Medicare, but Medicaid, and this is a new state program, and we do have it for you right now in the Who Wants to Know section. There are links to this entire new plan and program and how you sign up and that kind of thing, so that you'll be able to look at that right now. All right, Morgan, let's talk about folks as they're going to be getting online in the next month or so and looking at all of these health care plans. For the Affordable Care Act. There are so many plans and so many different prices that often it gets so complicated, and they think to themselves, I wish I could just have someone help me. And an insurance agent can help them, and it's not a cost to them. So let's talk about that.
Correct. So a health insurance agent can navigate healthcare.gov for you. We have broker software that we can route over and actually ask you the questions and put them in and get the eligibility notice at the end of the application, so we know how much of a tax credit that you're going to be receiving. Now, it does not cost anything. Agents are paid commissions. If an agent asks you for an application fee or any type of hourly rate, don't do business there. We are paid commissions, so that is no money out of your pocket. It does not cost more for you to work with an agent, or if you go directly through the marketplace. No difference in pricing.
Okay, and if you work with an agent, you don't always have to take what they said that you should do. You can take what their recommendation is and then go back to the marketplace and kind of do your own research and come back and forth, depending.
Absolutely, you can.
Okay, so we have a question that says, is health insurance required for everyone? Laura?
No. The federal mandate that was an original part of the Affordable Care Act, that was repealed at the end of 2017. Some states do have a state mandate, but North Carolina is not one of them. But even though it's not required, it's always a good idea to have health insurance.
This question, Morgan, says, once you get enrolled in a plan, how long before the insurance usually goes into effect?
So that was part of the American Rescue Plan that was just passed. So where we used to work off the 15th of the month, we now, if we submit an application on March 31st, you automatically get an April 1st effective date.
Okay, so March 31st, April 1st. So it's not a whole month waiting period.
Correct.
Okay, that is good to know. All right, Catherine, this question is for you. It says, is there a specific enrollment period for Medicare? And what is that? Is it going on now?
So there is not a specific enrollment period, except that when you turn 65, you have 3 months before and 3 months after to enroll in Medicare and begin your coverage, either by signing up completely or choosing to defer a piece of it, but you must make a selection. The other time that Medicare recipients do get involved with making decisions about their coverage is when there is open enrollment in the fall about their supplemental plans the next year, or if they want to move from standard Medicare to Medicare Advantage.
All right, and that is in the fall, so keep that in mind if you're looking at Medicare. All right, you can continue to text your questions. We're going to take a short break. We'll be right back. Welcome back. We are here talking all things healthcare. Morgan Campbell, Laura Packard, and Catherine Sevier. They are answering your questions about healthcare enrollment and also about Medicare as well. You can continue to text your questions at the number at the bottom of the screen. All right, so this person is asking, do you include disability income when figuring your income for the Affordable Act insurance?
Yes, you do.
Okay, and that's just a quick, easy answer there.
Yes, you do. Every time.
Every time. Okay. And then this next question is, what about those of us who are already enrolled? Is there a better plan that I can opt out and re-enroll?
So very possible it's going to happen in the plan. One of the things was that they were going to make silver plans at a zero premium, depending on your tax bracket, your income, your dependents that you claim. So you could go from a bronze plan of paying out some money to a silver plan that might not cost you as much, but you have to go in and complete your application April 1st.
Okay, April 1st. Laura, this person is asking, are there resources available to help people cover the cost of health insurance? I don't make a lot of money at the moment.
Well, the American Rescue Plan included beefed up subsidies for everybody, regardless of how much you make. So you should definitely go to healthcare.gov and make sure that your income is inputted there, or if you're working with a broker, they can help you. Now, North Carolina is one of 12 states that didn't expand Medicaid. So if your income is very, very low, you might not make enough to get help with the Affordable Care Act plans, which is why North Carolina legislature needs to act. But if you had, if you're unemployed, if you had a job last year and lost it, then you may be eligible for different kinds of help with your health insurance that way. So it probably makes sense to talk to a real human like Morgan to help you figure out your best options.
Right. And again, if you did not hear, the Affordable Care Act enrollment date has now been extended to August the 15th. So you have much more time to enroll. And the new plans and pricing will be released April the 1st. So you might want to hold off just a little bit so that you can look at that pricing again. I know, Catherine, we were talking about the Medicaid enrollment for the state. Is there anything else that you wanted to make sure that people knew about that?
So Medicaid enrollment ends on May 14th. Unfortunately, we have so many different dates to keep up with now. So it's important that you go and look at your plan because it will change July 1st, and you may want to make the selection of which plan fits your family's needs best.
Okay, and this person is asking, if you're not working, is there insurance that you qualify for? Which way would you tell them to go, Laura or Morgan?
I'll let Morgan tackle that one.
So if they're not working, but they're receiving unemployment, then they're probably going to qualify for a substantial tax credit to offset their premiums through the Affordable Health Care Act.
Okay, and again, if you call an insurance agent and you ask them about which plan is right for you, they are not charging you. So we want to make sure that you know that. All right, Catherine, this person is asking, do you sign up for Medicare online?
Yes, you can sign up for Medicare online. And that is really the easiest way to do it, but the Medicare offices are also available to help you if you don't have a good online confidence that you can do it.
Okay. Laura, this person is saying, if you already have marketplace coverage, will the premiums change, or is it just for new customers only?
They have said that they are going to make everything right, but you might not get your money back until you file taxes next year, which is why you if you've already got a policy and you don't go to healthcare.gov to update after April 1st. So you will eventually get there, but if you want your money faster, you should go back and go through the hoops again.
Okay, quickly, we have about a minute left. Morgan, could an ACA plan be more affordable than my plan through work? And if so, can I opt out of my work plan?
You would have to meet the income limits on that. We would have to do some calculations as your income and do you actually qualify for a tax credit. It's once again going to depend on how many dependents are in your house and what your income bracket looks like.
All right, and this last question, are you automatically enrolled in Medicare at age 65?
No.
No, you have to do it on your own.
Do it.
Yes. All right. Thank you so much for sharing your time and your expertise. If you missed anything, don't worry about it. It's in the 2 Wants to Know section right now, along with more resources as well when it comes to the Affordable Care Act, Medicare, and even Medicaid.